Good afternoon, good morning, good evening from all those that have given their time to join us for this third session of Applying Theory to Practice virtual conference provided by ISSUP. My name's Jeff Lee. I'm Senior Consultant with ISSUP and helped put this program together, which so far has been very exciting, interesting, I think extremely valuable as we address the real issue of knowing we need an evidence base, and we have an evidence base, but what is the challenges that we face when we try to put that into a practical dimension and apply those principles to the work that we do. And we'll hear today about how that applies to the issue of prevention. We've had treatment earlier today with very important inputs on the issue with respect to treatment, and yesterday a very interesting overview of that issue of theory and research and evidence base from Professor Harry Sumnall. Tomorrow we have the recovery support input. I want to say a little more because time is going to be short, and just to say the housekeeping things, just to say the certificate of attendance will be emailed to those who've attended this event, who've joined it, so there will be a certificate of attendance. I should inform you that the conference is being recorded, and we hope that will mean people can access it for anything that they might miss and share it with their colleagues. And as I say, I would recommend what's been offered so far in the two previous sessions. We will have a question and answer session at the end of today's session, and we would ask you, if you have any questions, to place them in the chat section on the platform, the GoWebinar platform. And we will gather them together and put them through to our moderator to address as many as we can at the end of the session. And just be aware there is interpretation available, and the full instructions on how to access interpretation in different languages is available in the chat on the GoWebinar platform, and it tells you how to get access to that interpretation. We hope you enjoy the session. We thank you for joining us. I'd like to hand over to Carlos Ibáñez from Chile, who has been one of the many national chapters who have been involved with our conference over this 3 days, managed by Heredia. We've got a very active group of national chapters, and they've been very active in giving us input. And Carlos is one of those who is supporting that. I will hand over to him to therefore moderate this session. We hope you enjoy it.
Thank you very much, Jeff. Well, greetings. I'm very glad to welcome all of you, both participants and speakers, to this session that, like Jeff just said, it's about prevention. Probably much of us were expecting this session. And like the spirit and the lemma of the conference, we will start with a presentation about the evidence and the theory behind the evidence that supports evidence-based prevention. And after that, we will have some national experiences, like examples of how that works in an actual country and an actual practical field. So we will have 90 minutes. We will have 3 wonderful speakers with us. The first more theory-oriented presentation will be in charge of Giovanna Campello. And after that, we will have 2 speakers that will show and share with us some experience about Peru and about Lebanon. And after that, we will have a session about questions and answers to discuss about these presentations and ask some questions to the experts. So I think that will be a very interesting and I was much excited to hear our presenters. So let me start introducing the first presentation. Is the evidence-based principle for undertaking effective prevention. And the title of this first presenter is Evidence-Based Principles for Working in Prevention, a consideration of the theory and science behind the principles. And our presenter is Giovanna Campello. I'm send her. Giovanna is the Chief of Prevention, Treatment and Rehabilitation Section of the United Nations Office on Drug and Crime. Giovanna has more than 20 years of experience with the United Nations Office on Drug and Crime in supporting the member states and stakeholders at levels in improving their drug prevention response, applying and contributing to scientific evidence. Most notably in this context, she has led the publication of the International Standards of Drug Use Prevention in 2013 and the UNODC WHO second update edition in 2018. Since 2016, she has been leading the Prevention, Treatment and Rehabilitation section of the United Nations Office on Drug and Crime, thus promoting evidence-based, gender and human rights sensitive practice on drug prevention, treatment and care and rehabilitation, as well as access to controlled drug and medical purposes. Mrs. Campello has a Bachelor of Science in International Relations from the London School of Economics and Political Science and a Master of Arts in Gender and Development from the Institute of Development Studies of the University of Sussex, both in the UK. Giovanna, please, can you start your camera and share with us? Hi.
Hi, and I'll try to show my screen. Can you see my screen and can you hear me?
Yes, both positive answers.
Thank you. So let me start now that I know that you hear me by thanking ISSUP for the invitation to speak and Carlos for his kind introduction. And of course, as you can see, I am not very disciplined speaker. I already changed the title that he announced to you, but the substance, I think you will see, does not change. I will not speak about the standards. I spoke in many times, including in the last international ISSUP conference. You can see the recording there. We can talk about it. I was really trying this time to think about how to make sure from the perspective of a practitioner to make sure that your practice is evidence-based. And if you are a decision maker, I hope you will find some inspiration in this slide as well. But I think that for you, there are other tools, the standards themselves, and of course, the tools that have been developed by Professor Sumnall that you heard the other day, and of course our very own Jeff Lee around the European Drug Prevention Quality Standards. They have an entire toolkit that can help decision makers make sure that the prevention they fund is as of high quality and evidence-based as possible. And maybe we can discuss this also in the question and answer session. And for me, I was thinking about this presentation from the point of view really of a practitioner that is doing prevention and says, like, what is what I'm doing evidence-based? How can I make it evidence-based? And of course, for as a first thing, I want to refer you to the definition of evidence-based practice. And I know that Professor Sumnal, had a very in-depth discussion of the theory and versus the reality of this definition. But overall, let's say for the purpose of this presentation, I'm working, and for the purpose of our work with the international standards, this is the kind of definition that we are working on. We are working on evidence-based practice. That means essentially practice the effectiveness of which has been established by a rigorous scientific process, and not by other kinds of knowledge, such as one's own intuition, the tradition of a place, or based on considerations such as, is this practice cheap? Is this practice visible? Do the youth like it? All very valuable criteria, but they do not tell us much about whether something is actually effective in preventing drug use and other risky behaviors or not. So given this definition, how can we make sure that our prevention is based on scientific evidence in practice? And so I was thinking in terms of challenges, okay? I think Jeff and Carlos mentioned them. What about the challenge? Yes, it's all very nice and good to say, we should do a prevention that is evidence-based, but there are, very serious barriers in practice. And one of the barriers is, of course, that evaluation is not easy. If we say, okay, we should only do prevention, the effectiveness of which has been established through a rigorous scientific study, of course, I know that I have lost many of you, because, including me, I would not be able to do evaluation that easily. Evaluation, to do it well, is also costly, and it's long. Let's face it, sometimes the effects of our prevention initiatives are not immediately visible, right? They are visible after a few years. And so it's not easy to evaluate the effectiveness of what we do. And so what can we do about that? One thing that we have been doing, that I present to you not as a recommendation, not as a guideline, but as a possible solution that is based on our experience as well, is to use the same attitude that you would use with regard to your clothes. Well, I don't know about you, but I am not a tailor. I am not a seamstress. I think many of you are the same. And so to really create suits from scratch is not easy. And the same as it is not easy to create prevention program from scratch. So for us, what we are saying is, why don't you use a ready-made suit instead of sewing a new one from scratch? Which means, in prevention words, why don't you use a strategy, the effectiveness of which has already been demonstrated by somebody else? Let somebody else do the hard work of doing rigorous evaluation, and you use that program, you use that strategy. And of course, very often that somebody else might be somewhere else, and you will need to think about adaptation. But there are some very good advantages in using this kind of strategy. You know that it works already. And also, because the strategy has already gone through an evaluation, the program or the strategy will have its own evaluation instruments that are ready for you. And we know that evaluation instruments are not easy to develop. And so you could just also, I mean, it's not completely ideal, but you know that this program has been evaluated somewhere else. You could just do a collection of data before and after and forget about having a control or even a randomized control. And with this pre and post, of course, it's not rigorous, it's not scientific, but if it is in line with the original study, you already start to have a good idea that you are on the right track. You are on the right track for being effective. So this is something that we have been doing in many countries. For example, I show you two evidence-based programs, Lions Quest and Unplugged, and I think one of the speakers following me will also speak about Unplugged maybe. And we also at UNODC, we have taken these evidence-based programs which have been developed in the US and in Europe respectively, and we have used them all around the world. Now, of course, you would not do this just by taking the program, translating it, off you go. You need a systematic process of cultural and local adaptation that makes the program adapted to the local culture, but it keeps the program effective. So there are many guidelines on how to do this, and in fact also around the European quality standards for preventions there is, around the European universal prevention curriculums, they have developed a guide to how to do adaptation that could be useful. For us, we use the chapter 4 of this guide. This guide is on family skills, but we devoted an entire chapter on how to do a systematic and respectful process of adaptation. And we have been using it all around the world. And so I think I recommend it to you to keep an eye on. And it does work. So look at this. We use this program, in particular Lions Quest in Montenegro, and we did in this case a proper evaluation with the control group, and we could really show that our program prevented initiation, lowered marijuana use in the last 30 days, and decreased the intention to use. So we were being really effective in preventing use. There are other challenges. I don't know, many people tell me where to find evidence-based strategies, and this is a very, very valid point. If you look in the standards, you don't find them, you find descriptions, because of course some of these programs are also copyrighted, and in the standards we didn't want to become free publicity, but you still need to look for strategies, right? And our suggestions there is, of course, there are at least 2 databases that exist all around the world. One is Blueprints in the US, one is Exchange in the European Union, and where somebody has done the hard work for you, has looked around and found evidence-based strategies, and you can just look and find the different characteristics of these strategies. And I would really encourage you in this respect to consult with each other. We are, how many are we now? Almost 300 people, and I know that many more are connected through ISSUP on their wonderful platform. Reach out to your peers, ask them about their experiences in implementing different kind of strategies, and help them find the one that is right for you. Or write to me and to our team. We have been using using these registries for some time, and we can help you navigate. And of course, there will be some programs that are costly, but some are less costly than others. There might be shortcuts. So together you can find a way to, we can find a way for you to find a program that really suits your needs and possibilities. But you might be already in the position that you're already doing something, right? You're not starting from scratch. You're already doing something. And so how do you know whether something is, what you're doing is evidence-based or not? Of course, you should evaluate, right? But let's say that it's not possible for you. So what I would suggest at this stage is to use the standards to see whether you are on the right track. And I want to use the example of preventive education as an example. So in the standards, let me see if I put it. No, I didn't put it. There is a table that I usually show. I'm sorry, I didn't put it in the slides, with all of the list of interventions that have been found to be effective in preventing drug use in the standards. For each of these interventions, we have a list that tells you if you do this intervention in this way, it's gonna work. If you're gonna do the intervention in this other way, it's not gonna work. So for example, in the case of prevention education for early adolescents, we know that what works is a certain kind of content, learning and practicing personal and social skills, working on the perception of risk, especially emphasizing immediate and realistic consequences, and of course discussing the normative nature of substance use, so how normal it is. Children sometimes have very peculiar ideas about how normal it is to use substances. We know that interactive methods work, that it needs to be a series of sessions that are structured and delivered by very well-trained facilitators. We also know what does not work, using lectures, only giving information, using one session only, focusing only on self-esteem, only on moral decision-making. All of these, we know they do not work. So what you can do is to take your preventive education program or any other program, let's say take the prevention education program, and compare it to this list and see where you could improve. It's not scientific, right? It's not evaluated, but you are using the experience and the science to improve your practice, and this would already be very helpful. So that's a possibility, and I gave you the example of preventive education, but as I mentioned to you, for each one of the interventions that are included in the standards, there is a list and you can do this kind of work. Sometimes, and this is a challenge that happens often, there is not a program that is good for your needs. There is not a strategy that has been found to be effective by science. And this is normal because the standards is a summary of the existing science, and the science has a lot of gaps. So this can happen, particularly if you're working with very, very vulnerable children. And at this stage, what can you do? Well, I would suggest the following. First of all, again, I put it third, but I changed my mind. It should be your very first point. Link to your peers on ISSUP, maybe to us on UNODC. Ask around, what are other people doing? What are their lessons learned? What is working? What is not working? Even if there is no science, there is a lot of practice that might help you to decide what to do. And then, of course, try and link to your local university to start developing a new program and maybe to start evaluate it. And if it's possible for you, look into long-term funding so that you are able to make it grow and maybe develop a proper evaluation. And so these are possible suggestions, and in these particular cases, we are particularly glad to support you, because if you manage to create something new and to evaluate it and to show that it's effective, is something that will benefit the whole world. And once you have decided what to do and decided to do something that is evidence-based one way or another, there is still some other things that you can do to do this, to do it well, to do it in a way that really supports and contributes to the evidence. And I have some suggestions as well. They are not rocket science, but you would be surprised how many times this doesn't happen, right? The first suggestion is, of course, to train the people that will deliver your program very, very well. And in this context, I will not say much more, because I know that the presentation of Fernando that will come after mine will look precisely on this, how a special kind of training made an enormous difference to implementation in their experience. And so I think you will find that presentation inspirational and very, very interesting. But in general, of course, one of the things that we see this again and again not working is that the people that are delivering the program are not well trained. They don't know the program very well. They don't know the strategy very well. They don't have a good idea about the very basic principles of prevention science. And now you're starting to have no excuses. ISSUP is building an entire encyclopedia of videos and resources that you can access to build the knowledge of yourself and your staff. So I think that that is certainly something that needs to be paid a lot of attention to. Another very, very important issue is to document the process, and at least really pay attention and keep track whether you are reaching who you needed to reach, and you are delivering the activities according to plan. And you would not believe how much this does not happen, how much I see reports saying, yes, the activity reached many, many youth. And then I ask, but you said the activities you wanted to reach youth that are a lot at risk. Did you reach those, or did you go for the easy to reach kids that are in the local, I don't know, community center or in the local school? And that makes a huge difference. Or you are using an evidence-based program and it has 10 sessions, but 2 sessions are a bit too long or a bit too difficult, and you kind of forget. That will impair the effectiveness of your program. So build a good plan and monitor that you are implementing according to your plan, so that you know what you are delivering and you can correct things if they're not going on, if you're not on track. And of course, try and document the outcomes. What is the impact of your activity? Even if it's a data collection before and after your intervention, it It's not scientific. You cannot say that changes are due to your program, but it tells you whether you are on the right track. Maybe you can compare to some national trends and really already see whether you are doing better or worse. And it's really, really important that we get, as practitioners, we get into the habit of documenting the outcomes as much as possible. And lastly, let other people know about it. Don't keep your results for yourselves, even if they are failures. In fact, I would add, especially if they are failures. We, and I'm sure that I'm speaking here for all of the colleagues that are represented in ISSUP, will never think you are a failure for it. In fact, we will commend you for having the strength of saying, look, we did this, it doesn't work, and then maybe discuss together why it did not work and find a solution. So it's really, really important, because that will help everybody learn from each other. So here is when I was corresponding with Jeff. He said, I would almost look at a checklist for our practitioners on how to improve their practice. And so I said, I will try. And this is what I've come up with. And this is just a summary of what I just told you, right? So use an evidence-based strategy. And we have seen how it's not easy, but how there are possible solutions to the challenges that you might need, you might meet. Train who will deliver the strategies, train them very well, document your process, especially how the people that you are reaching and the activities that you are implementing, and comparing to your plan. Document the outcomes, at least short term, and at least, you know, pre and post your interventions, and let other people know about it. And I am sure that you will thinking, hang on a second, Giovanna, you're missing at least 3 very important points that I have in my mind. And I'm very much looking forward to hearing these in your question and in our question and answer session. So that I can enrich this list, and I can use it all around the world and start building something that is really strong but very practical for all of us that want to improve our practice in prevention and make it as evidence-based as possible, as effective as possible, really supporting the healthy and safe development of children that you see here, and youth, of course. So I think I am done. You have here my my contacts, and of course, if you don't manage to write them up or to look at the recording afterwards, you can just write to Jeff and Giovanna. They know where to find me. And with this, let me close and thank you for your attention. And I leave the control to dear Olivia, who is managing this platform that I don't understand very well, and I give the floor back to Carlos. Thank you very much.
Thank you very much, Giovanna. Actually, you although you were not so disciplined how you start your presentation, I think it's wonderful. It's a wonderful presentation, and it's helped to bridge the gap between theory and practice. I think it's very much aligned with the main lemma and concept of the conference. So thank you very much. Well, I have the pleasure to introduce our second input of the session. It's about applying the principle to practice, a case study of how the evidence-based principles for prevention have been applied in the practical country setting. And we're going to start this presentation part with applying the principles to practice in Peru, the UBC case study. And the presenter is Dr. Fernando Salazar. He is a principal professor at the Cayetano Heredia Peruvian University at Lima, Peru, and he is part of ISSUP Peru 2. Dr. Fernando Salazar is a principal professor at Cayetano Heredia University. Dr. Salazar seeks the implementation of quality standards for substance use prevention programs and pursues his certification as master trainer at the International Center for Credentialing and Education of Addiction Professionals, ICCE. I have the honor to let you with Professor Fernando. Please, Fernando, we are all ears.
Thank you so much, Carlos. Just let me ask you if you are looking into my screen.
Yes, we hear you and we can see the screen perfectly.
Thank you so much. And thank you so much, Giovanna, for your nice introduction that it reminds me what we did in Peru and what worked in Peru following the international standard and the universal prevention curricula. So instead of delivering some of the theory that was developed really very nicely by Giovanna, I will present the practical implementation of the school track, the prevention school track in Peru based in the UPC. Just to remind some points, the UPC track training focus in the school settings establishes that we should start with the school policy, then implement the school climate, and these two areas created the condition for prevention, and in that condition, you can implement the prevention curricula. We use it unplugged and later Lion's Quest. Before this is one of the parts that is not clear at all in many interventions, is that we need to build the prevention leadership and action teams. This is coming from the implementation science. These others are coming from the prevention side. With this in mind, we started making clear the objective of the project we developed in Peru, in which the objective was to train school staff, principal, and school teacher in the universal prevention curriculum and also in the school prevention curricula, let's say unplugged. And after that, we should start with the practical implementation of the three components of the school prevention and see the final results, measuring use of substances. The study design of this RCT was very easy to make clear to schools. From a group of homogeneous schools, randomly they were assigned to intervention or control schools. The difference is the intervention school had the training in the universal prevention curricula plus unplugged, and the control schools just unplugged. This is the usual way that in many countries is seeing the school prevention. So the added value of the universal prevention curriculum should make work in a proper way to unplug it. And what were the training and implementation results? As Giovanna said, it's very difficult the monitoring and evaluation of these interventions. So one of the things that we learned since the beginning using the core course is the standardization of the interventions. So that make easier the monitoring of all the implementation. So we trained it in the core course, the introduction to the universal prevention curriculum, that is all the theory around prevention. And as results, after that training, we have the schools agreement for implementation of the intervention. This was not happening in the control schools. We also have the participants agreement to keep working for the 3 following years. And as a result of this learning, we have the needs and resources assessment for each school. So we have the background, the grounds for starting the implementation. The implementation starts with the courses 1, 2, and 3 of the school track that have the contents of the role of schools in prevention. And this is a key point for sustainability, in which the focus of this course was to link the areas of the school prevention with the areas of the Peruvian educational curricula that must follow all the schools. After that thing, that was key for the school teachers to understand that they were not going to work more than the usual work, but they were going to link the learning in this training to the areas of their current work. The second course teaches how to build teams for a comprehensive school-based prevention. So as a result of this course, we have the school prevention and leadership action teams in each school. The leader of this group, of these plats, are the principal of the schools. There are representative of the students, of the administrative staff, of the school teachers, of the members of the surrounding community, and parents of the school of the students. This was something that started changing the feeling in the schools about prevention, because we use a very standardized, persuasive speech just to bring attention about prevention. The third course of this group of courses was creating substance use prevention policy in schools. We follow strictly the indication of the international standards that are in the UNODC. So we have the school policy on display and how this looks in a real setting. These are a picture of the prevention leadership and action teams in each school. They were launched in special ceremonies, and then they prepared the school prevention policies. We used the map of Peru to put the main ideas of the policy, and each school has this displayed in a very special place, in a very visible place in the schools. Also, we used the charts in many places of the schools. This was designed by the school teachers. So the school substance use prevention policies were on display in the schools. They were launched in many different ways, in different hours. The school children were practicing the things that said the school policy. After that training that took us several weeks, we started the training of the three following courses. Was creating a school prevention climate that is focused on the will of resilience, selecting the evidence-based school prevention curricula, following what just Giovanna told us minutes ago. And then we reinforced the action planning to create a comprehensive substance use prevention initiative. So we started the school climate practices. We selected the unplugged as the prevention curricula. We adapted following the UNODC indications for local adaptation, cultural adaptation, language adaptation, visual adaptation, and contents were kept as they are in the original program, and this was controlled by the developers of Unplugged, as also says the international standard. So we used the chart after the course 6 just to reinforce what we did at the beginning of the intervention with the core course. So we have planned everything since the beginning, so the school teachers were introducing new things in the chart. This was key for starting the practices, just welcoming the kids at the entrance of the schools. The teachers were surprising the kids. They were knowing the names of the kids. The school teachers in the classroom were following the indications about how to create a good classroom climate. That was also at the school environment, and many things that were following the international standards. With that thing, with those two things, we started with the school prevention curricula training, Unplugged, and the school teacher were piloting the sessions just for adjustment of the intervention and for further adaptation, respecting the content of Unplugged. So we piloted this, we did an additional adaptation, we conducted, the school teacher conducted the sessions on Unplugged. This card here is at the end of all the session in which the kids really had a very good time with that curricula. It's an amazing curricula that not only gives happiness, also is very effective. After that, at the end of 2018, we delivered a positive classroom climate and the interactive teaching skills that were easily adapted by the teacher, because interactive teaching skill is part of Unplugged, and the positive classroom climate also comes from the Unplugged. We were focusing in positive classroom climate, focused in the development of adolescents and kids. We were not delivering nothing else. We were, the school teacher were using the interactive teaching skills also with their colleagues. And so we started moving the schools. How this looks like? This is the interactive teaching skill and positive classroom climate. The schools started shaping their delivery of many courses, not only the prevention sessions, for their teaching practices. This is a small group of kids working. They were practicing effective communication, etc. And this was, with all of these things, we could adjust our logic model in the 2018 and prepare this for the 2019 intervention. At the end of the 2019, we have this knowledge about all the process, and also we were following during those 2 years the short-term result, the intermediate results, and the final results. So we saw since the beginning how the school's policy was adopted by the schools and how the kids know about it. The red ones are the intervention schools and the blue ones are the control schools. We also see betterment in the school climates in the intervention schools. Let's say about the intentions through drink were lower in the intervention school, the alcohol use was lower in the intervention schools, also tobacco and also marijuana. And for that was happiness at that moment. We were really very happy and also showing results. So what we did is to reach some conclusions. The universal prevention training curriculum related school policy and climate changes were effective in reducing substance use and related problems among Peruvian adolescents. The randomized controlled trial of the UPC school curriculum provides initial evidence in support for UPC training as an effective means of disseminating prevention science concepts, skills, and practices designed to support the implementation of evidence-based intervention in developing countries. We were happy at that moment, and let me introduce some other slides. In March, when we were just looking the autonomous implementation of the intervention in the schools, officially started the pandemic in Peru. So schools were closed. So we have to take our knowledge about how to implement a program, and we adapted our logic model for the pandemic conditions. We decided to make almost everything again for these conditions. Of course, the implementation was, the training of the school teacher was online, and the remote implementation of the components of the school intervention were conducted online. So we started very easily launching the school policies again through different platforms. The school policies were linked to the COVID-19 policies because that was in our mind as an important issue, as also says the international standards. If we link this kind of programs to other programs, it's going to work better. Principals were launching the school policies, the students, they used many things. We also started making the challenges to the to sustain the activities with children at home. At this moment, we found that the children were, thank you, the children were also sharing their challenges with other kids. We decided to keep that in that way because we were not going to do any harm. Then the learning through service component was conducted, was designed by the kids and conducted by the parents to help some families in need during the pandemic. So we could do that thing, but we needed to have something similar to the school curriculum. So we take on to the family connection component of Lion Quest, and we made a capacitation with a certified trainer of Lion Quest online. We make the implementation remote, and in places in which we could not go through the internet, parents were delivering the material to other parents, keeping the rules of the COVID-19. This is the monitoring of the implementation of family connection. This was the technical assistance that the university team was doing to the school teacher, and they decided rather to share among them all the learning. So we created a learning environment or learning community with the school teachers. These are some of the things that the family were showing us. Even some schools in the rural areas took the mothers and students to discuss the contents of family connection. And the results were measured in one of the mediators, what was the family functioning. And we also see positive results in this area. Hopefully, we will see some results in substance use at the end of this year. This is the evaluation of the 2020 year. This program was made thanks to the collaboration, the generous collaboration of the Colombo Plant Drug Advisory Program and the U.S. Department of State Bureau of International Narcotics and Law Enforcement Affairs. And thank you so much for Celia Loboda, the mother of the Universal Prevention Curriculum, and the nice colleagues, Chris Ringwald, Mali, MJ Pascal, Joel Group, that were just taking care of all the evaluation and monitoring of the analysis of the monitoring and evaluation. And also to my colleague, Susana Balojara. Thank you so much.
Thank you very much for your presentation, Professor Salazar. It's a very impressive work, and thank you for sharing it. Now, our last but not least presenter is, I have the honor to present Anthony Abi Zeid. He will talk about a prevention case study from Lebanon, practice challenges. Well, he is a program associate and mentor for Arabia, and he is part of the ISSUP chapter from Lebanon. His work in the humanitarian field has been Anthony's passion since adolescence. His milestone started when he joined the Lebanese Red Cross as volunteer in the youth sector in 2007. This first step led him to become the person he is today and was the backbone of his career. He holds a master's degree in planning and management and a bachelor's degree in law studies from the Lebanese University, Faculty of Law, Political and Administrative Science. In addition, he develops and implements projects, creates content, and trains on a wide variety of topics such as life skills, personal and career mentoring, child protection, drug prevention, and facilitation skills in Lebanon and some Arab countries. He was by or implemented in partnership with international, regional, and local partners such as UNICEF, UNRWA, UNHCR, WFP, and UNODC, among others. He has participated and presented at several national and international conferences hosted by ISSUP, EUSPR, and World Summit and others. He has also been invited to give motivational speeches at events in Lebanon and was hosted as a guest on Lebanon TV channels to spread the message of OSA, an inspirational social media platform that he co-founded in 2018. Anthony, thank you very much. We are prepared and ready to hear your.
Thank you so much, Carlos. Are you able to hear me well and see my screen?
Both right, yes.
Okay, thank you so much, Carlos, for this introduction, and I want to thank ISSUP for this invitation, and thank the speakers who gave us a very fruitful presentations. From my side, I will talk about the experience of Mentor Arabia, who is a host organization of ISSUP Lebanon, and implementing two programs, mainly one evidence-based program, which will be Unplugged, and another evidence-informed program, which will be 4Z. First, a very quick introduction, as they already talked about the technical background of evidence-based and evidence-informed. And as you know, evidence-based can be for practices and can be for programs as well. And evidence-informed is when we want to use backgrounds and evidence to promote and develop programs. These standards or this evidence should be based on guidelines and rules that are written and conducted in the public in mind. And in our situation, and ideally, evidence-based and evidence-informed programs and practices should be responsive to families, cultures, backgrounds, community values, and individual preferences. And that's what we did while implementing Unplugged in the Arab region and 4Z in Lebanon mainly. I will pass very quickly on the introduction for our session. As for the evidence-based, you will see that we have evidence-based for programs and evidence-based for practices. And we'll take the example of Unplugged as evidence-based program, and we'll take the example of 4Z as evidence-informed from the practices and international standards that we have. Okay, we'll take the examples for prevention programs as the 4Z and Unplugged, they are prevention programs. Mainly Unplugged, it's a program that do prevention on drugs, and 4Z, it's a program that can be a prevention program from drugs and a prevention program from generally risky behaviors. Unplugged, as you know, is a prime example of evidence-based prevention and refers to prevention programs, strategies, and policies that have rigorously tested under research conditions and found to be effective in changing adolescent 12 to 14 years drug use behavior and attitude. And this program, as it was like developed to be implemented worldwide, as it's an evidence-based program, and as Giovanna mentioned, it is adopted by and supported by UNODC. Mentor Arabia took this program and tried to integrate it in the curriculum in different Arab countries. And we'll take the example of Lebanon, Jordan, Sultanate of Oman, and Palestine to talk practically how we did integrate this program in school curriculums and how we did receive the blessing of the ministries, especially the Ministry of Education, as it's super important for us to have this blessing to reach more people and be able to implement this program in different schools in that countries. Okay, I will pass very quickly to go to the practical example. I will give you examples about the implementation of Unplugged in Jordan. In Jordan, implementing prevention about drugs was something restricted to the police to do that. Social workers and school counselors were not allowed to talk about drugs in schools. And that's why we had a very good communication with, but very hard in the same time, with the Ministry of Education and Higher Education in Jordan. And we were able to convince them to implement Unplugged based on the evidence that is behind Unplugged and the experience of Unplugged in different European countries. And this background gave us the power to go and talk and convince the Ministry of Education and Higher Education in Jordan, and to change their mindset to allow us to implement this program in partnership with one local partner and with the ministry. We were able to implement Unplugged in Jordan on a national level, in all public schools. This program was implemented there after being like this topic was being restricted to be implemented by anybody other than the police. This experience gave us like the power to go to other countries and promote this program. And we had the chance to go to Sultanate of Oman, and there we implemented this program and did several negotiations with the Ministry of Education in Sultanate of Oman to allow us to implement the program in partnership with a local partner, and based on our experience, and sure, because there is evidence behind Unplugged. And that's what happened in Sultanate of Oman. The program now is a national program in Sultanate of Oman, and it's implemented on the majority of the public schools. In Palestine, things was a little bit difficult, but as Palestine is too close to Jordan, and they are from the same cultural background, they are coming from the same cultural background, we were allowed, after as well negotiations with the Ministry of Education, to implement this program in Palestine. But in all countries, we had to do some adaptations to the local context, changing some words, amending some activities, but keeping the core of the program as it was, because the evidence was on the program itself. Then we just did the adaptation for the cultural and for the context. In Lebanon, we had several negotiations with the Ministry of Education and Higher Education, and the Ministry of Health was involved. And as Unplugged has a great reputation in Jordan, in Sultanate of Oman, in Palestine, and sure, worldwide, we were able to convince the Ministry of Education and the Ministry of Health to allow us to start by a feasibility study to implement the program in Lebanon. But in Lebanon, we had some challenges in terms of the country itself, and we are still in the process of the feasibility study, and we have to revive it now. There is always like the importance of having an evidence base is always because we need the blessing of the Ministry of Education, because when you have the blessing of the Ministry of Education, you will have the key to enter to the schools in your country. And the schools are the best form for prevention of drugs, alcohol, and tobacco consumption. And for reaching a significant number of students each year, it's really important to have like the presence of the Ministry of Education and the presence in the same time of a local non-governmental organization who will support in the implementation, in the advocacy, and in the promotion of the program in the country itself. The educational curriculum can form part of an integrated preventive approach, and that's why the ministries and the countries that I I told you about were like motivated to implement this program because they integrated in their curriculums and in their preventive approach. We did support the local organization and the ministries in these countries by effective follow-up in terms of the duration of the implementation, and based on the pre and post test and the result that we are receiving every year from the schools in each country, to allow us to do and make adjustments if needed. Why do we use like evidence-informed program? For us, implementing evidence-based, it's always our prior goal. But sometimes you will be facing challenges in the country itself to promote and implement evidence-based programs. For example, 4Z is fourth generation Z, a program that has 4 pillars: mentor, inspire, empower, and prevent. It's a program, it's an evidence-based, evidence-informed program. As Giovanna mentioned, if you want to have an evidence-informed program, you will need a lot of time. You will need a high cost. You will need a huge evaluation to be able to say that this program it's evidence-based. And sometimes we will need to do a quick intervention where this intervention should have to be customized for a specific audience, and that's why we developed 4Z. 4Z was developed for private schools in Lebanon after receiving calls for intervention, need of intervention to implement a preventive program from general risky behaviors. And based on a quick needs assessment, we mentioned that in that schools we have like several areas that should be tackled. And based on this, we developed 4Z. As a background, we had like an evidence-based practice, which is the international standards on drug use prevention, the one of UNODC and WHO as background, and we had Unplugged as a background. And then we developed 4Z, which is a program that aimed to strengthen adolescent and youth protection capacities through the implementation of life skills empowerment and risky behaviors prevention activities. This program, it's a huge basket, who contains 14 themes: self-esteem, decision-making, refusal skills, drugs, time management, social media awareness, communication skills, coping skills, bullying, addiction, empathy and positivity, goal setting, conflict resolution, and group dynamics. When we go to implement this program in a school, in a specific school, we do a quick needs assessment. We see where are the gaps, and then we pick from this session at least 7 topics. Then we go and do the program with the students. This program was implemented firstly in Lebanon, as we had received the calls from the Lebanese schools. Then we had a partnership to implement a similar program in Jordan. What we did here, we did an adaptation for 4Z and the local context of, based on the local context of Jordan, and we added to this program a component which was requested by our national partner in Jordan, which was to add a CV writing session and like a career development session. And here, this program was adapted. We chose some of the themes from this program. Then we implemented this program in Jordan in addition to some career development session. But here, we had like a pre-post test. We had an evaluation for this program, but we were targeting the attitude of our beneficiaries. We cannot say that it's an evidence-based program. We didn't do an assessment for the behavior. As you know, to assess the change in the behavior in our participant, we have to have follow-up with them and evaluation after 2-3 years of the implementation of our program. then here it was quick and very feasible for us to implement 4Z instead of implementing unplugged and going through a huge process with the ministries. And in unplugged, I have to take it as it is. I cannot amend on the topics or change or adjust on the topics. Mainly, the factors that we considered when developing 4Z was a strong theoretical and research background, clear theory of change to explain how it will achieve the intended outcomes, evidence-based interventions and or practices, program manual and documentation so it can be replicated, qualified facilitator to conduct the activities, program evaluation to determine if it was successful. But here, if you can see, we didn't say that it was like an evidence-based program. It was an evidence-informed program, as we took evidence-based intervention as background for this program, and we did the evaluation. At the end, I just want to say that taking unplugged in the Arab region as a huge example and implementing it in different schools in the region was a very successful experience. But as well, we can sometimes use evidence-informed programs if we need to implement something very quickly and target our audience in a tailored way, but taking into consideration best practices, international standards, and as well the evaluation of the program itself. If we have positive result, we will duplicate the program. And here in the Arab region, for Unplugged, we had very positive results from Jordan, Sultanate of Oman, and from the pilot in Palestine. And for 4Z, the program had very successful results. We are aiming to develop an evaluation for 4Z to make it as an evidence-based program, but we have some restrictions in terms of financials, time frame, and all the logistics needed. But it's always like our goal to have a program developed by our organization to be like an evidence-based program. But in the meantime, we have Unplugged that we are adapting to the context of different Arab countries, and potentially we will have it in more than these 4 countries. Thank you so much for listening to my presentation. I wish that I was able to bring like concrete example from our experience in the Arab region that you can maybe benefit while implementing your programs in your countries. Thank you so much.
Thank you very much, Anthony, and thank you for the last 3 speakers. It's very interesting. There are many questions that the participants are asked already, and please, Giovanna and Fernando, can you start your exactly your cameras? And okay, so there is some. Fernando, okay, perfect. Well, there is a few questions that are for all you 3, and another few that are specific. I will start for one question that I think maybe you can all of 3 comment about. The one question is about if you can signal or name the 2 or 3 main challenges for work and implement prevention at the local level. Can you discuss about that or share with us your experience in that subject? Maybe we can start with Giovanna and after following the initial order, or as you prefer.
So for me, apart from what I have described already, then the challenges become really specific to the kind of intervention that you want to implement. So school-based prevention, the challenge becomes getting the attention of the headmaster, getting the attention of the teachers, as I'm sure Fernando has experienced. And in family-based prevention is being able to convince the parents to come to the session. What we have seen again and again working better is to start slow and give yourself a lot of time to meet all of the stakeholders and really present your program and address their concerns. They will have concerns and you need to address them. And second, also to start small, like family-based prevention. Everybody says, the parents don't come. It's true. At the beginning, you get a small group of people that come. But once the word starts going around, you get more and more people interested. So I think that, at implementation level, this is the kind of things that we hear a lot. And the only suggestion is to take your time with your preparation, like I was also mentioning in my presentation. The other very big challenge is to choose what to do. And I've given some suggestion in the presentation. And if not, I cannot underline enough the importance of reaching to your peers and get their ideas, and if not, contacting us, and maybe we can put you in the right direction.
Thank you, Giovanna. Well, I think this kind of conferences and activities are a good chance to reach peers and know what everyone's doing. Huh? Thank you. Fernando?
I think that one of the main challenges that we had in the last year, in Peru in particular, was the political instability. As Anthony presented, we were also to the head of the Ministry of Education to present the intervention. And 4 ministries said, this is wonderful, this is okay, let's do this. And after that, the karma that I was taking to those persons, but they were fired from the job. So we were making a lot of job trying to convince them, and we lost all of that effort. So we have to go to the basics of the rules in the school settings. So the schools are autonomous if they are not living behind the school, the educational curriculum of the Ministry of Education. So they start raising all the information above. So that was a very big task, because the school teacher, of course, know what they are doing, but communication was slower. And the next challenge that we faced was that we had to work a lot to keep the rotation of the school teachers in the same level, let's say the same class, and in the same school, because there are a lot of rotation of school teachers. So we could face a loss of our trained people, but we have to work pretty hard also to keep them in the schools.
Great. Thank you. The importance of the developing like the human resources focus and training. Thank you. And Anthony, can you please share with us your experience about the challenges, or the main challenges you have found in the different countries you work with?
Okay, I will mention some challenges from the Arab region, mainly 3 as you asked for. The first one is the capacity building of local actors in the countries. For Unplugged, we were in each country, we had to first implement a training of a national board who will be responsible from the program, then to build the capacity of trainers, then to build the capacity of the teachers. And in many countries, we face the challenge that you have to start from scratch. You have to start from basic information, then go to the international standards, then go to be very specific about the topic, because there is a huge need. The second point is the policy and the government. The support of the government, it's not that easy. We had several sessions and negotiations with ministries in order to convince them to be able to implement the programs in their countries. And the policies itself, they are not considering like the drugs as like the problem as we are seeing it as local actors in each country. And the third one is about the culture. Sometimes in some countries, the culture is against you, because, for example, in some countries, the culture of having like smoking shisha is something that it's usually done on a daily basis in each house. But if you want to go and prevent, my father, my mother do it each day, and it will be super hard for the students and the beneficiaries to understand what you are saying. And on the other hand, the culture of who is allowed to talk about prevention topics. As I mentioned, in Jordan, it was restricted, just the police can talk. And you know, if you want to go as a child, if I want to be had like an activity about prevention, our programs now are all interactive, and someone from the police coming and telling me a lecture, it will be like hard for me to understand or to be able to go with this information and be like motivated to change my attitude and my behavior towards drugs.
Thank you very much, Anthony. Well, the next question is about the importance of policy and the more like focused on national policy. Specifically, the person asked about some examples about tobacco sales, but I think it's a wider subject. It's about how can national policies that can restrict the sales of alcohol or tobacco, or influence more the prices, and more like a national policy interact with this like more program focused practices and work. How effective are those national policies, and how they interact with the work of more focused in people? I don't know if, yes, Giovanna, please.
Yeah, I mean, as from our point of view, those kind of policies are very effective and essential. And so if you look in the standards, you will see that they are included as one of the strategies that have been found to be effective in preventing drug use and other risky behaviors. And we say drug use, but of course we look at all of the use of psychoactive substances. I mean, there are many different kind of policies, and in the standards you find the summary that we have done on the basis of the guidance from WHO, because WHO has been taking the lead in looking at what works and what doesn't work in terms of tobacco and alcohol strategies, and they have very clear guidance that has even been endorsed by member states. So where there is a commitment at political level to do certain things, that is very, very clear. And they are all about limiting the access, particularly of young people, of tobacco and alcohol. Higher prices, closing times, ages, limiting advertising, and so on and so forth. I just mention the main ones. There is more detail in the standards, and also there is the link to resources in WHO. If somebody is interested, I can put people in contact with the colleagues of WHO. They're super helpful.
Thank you, Giovanna. Fernando or Anthony wants to add something, complement something about this subject?
I think that one of the challenges that at that level is not only to convince the to politicians or the policymakers to implement to deliver the prevention public health policies, let's say that, but it's also the implementation or the regulation of the enforcement of the politics, because we are plenty of some good ideas that are not implemented or are not followed. So if we don't follow the implementations, yes, it's not going to work. Thank you.
Okay, thank you. And Anthony,
I totally agree. I totally agree with Fernando and sure with Giovanna regarding the implementation of the policies. And I can share here an example from Lebanon. We had a policy about the restriction of the smoking in private places and closed places like restaurants, for example. But here, the culture of our people was the base why people were not implementing this policy, because for them, going to a restaurant should be we should have a shisha in the restaurant, or we should smoke while eating our Lebanese food. That's why a majority of our population were against this policy, and they said if this policy will be applicable, most of the restaurants will be closed. But they didn't take the risk that is made on the health of our population while continuing our culture in smoking and eating at the same time.
thank you, Anthony. Well, there were a few more questions that unfortunately, because of time restraints, we will not be able to address. I want to thank you, all the three wonderful panelists. It was very, very interesting hearing from you, from your experience and your knowledge. Thank you very much for sharing that today. I want to also thank all the attendees, all the participants that were connected to us and shared their questions and also were very interested in this subject. And I want to invite you for tomorrow's third and last day of the conference, which I'm going to be, I'm sure, a very, very interesting journey too. So thank you very much. I think this has been a wonderful session, and we can all go happy and satisfied with it. Thank you very much all, and have a good day. Bye.
Bye.
Thank you, Carlos, and thank you, ISSUP.
Nice to see you.
Thank you.
Bye.
Bye-bye. And thank you very much indeed.